Now we'll move to the next heading, which we're trying to talk about the pathogenesis of abnormal uterine bleeding. So pathogenesis of any disease condition is like you're trying to look at step by step to how possibly this disease came in. Okay, so for abnormal uterine bleedings, is bleeding that we say maybe if it is during menstruation, the menstruation is too heavy than normal, or the menstruation is too long than normal. Do you understand? So the pathogenesis, okay, what are the possible ways this bleeding came in? So it involves structural and non-structural ways. Okay, structural ways, this is when there is bleeding and you can structurally say, okay, this is what is causing the bleeding. While the non-structural is more of like systemic complications, you can't actually pinpoint. So we usually use the mnemonic known as a PALM-COEIN classification, or PALM-COEIN mnemonic. Okay, so for the structural ways, what are the possible pathogens? So it could be polyps. So polyps is all those benign growths. I think I don't really even need to show pictures of this. These are things that everybody watching this video must have known. So they are benign growth of the endometrial tissue. They cause irregular or heavy bleeding. Adenomyosis, this is when the tissues of the endometrium, okay, tissues supposed to be here, they are found outside that region. Okay, then Leiomyoma, that's the uterine fibroids. Okay, malignancies, of course, cancers eating deep into you, they disrupt some blood vessels, they can cause bleeding. Then for the non-structural causes, or the pathogenesis which is related to the non-structural aspect, we have the coagulopathies. So generally, maybe a patient could have disease condition that is making their blood clotting system to be slow. Okay, like von Willebrand disease. It could be ovulatory dysfunctions. It could be that the patient is not menstruating, so all of a sudden the menstruation comes back and is so heavy. Do you understand? Endometrial issues. Okay, sometimes it's surgical related or drug related, side effect of some drugs that you are taking. Then the N is what is known as what? Not yet classified. All right, so these are the possible ways in which the abnormal uterine bleeding could actually come in.